That should be us now, Councillor.
Thanks, Elaine. So morning everyone and welcome to the Renfrewshire Health and Social Care Integration Joint Board Audit Risk and Scrutiny Committee. Quite a mouthful. So first item on the agenda is apologies. Do we have any apologies this morning, Elaine?
No, I haven't got any.
Great, okay, we're all here, good. Next item is declarations of interest. Any declarations of interest? No. Okay, no declarations of interest. So we'll move on to the agenda proper. And item 1 is minutes of the meeting held on the 9th of September and the special meeting held on the 26th of October. I won't go through them page by page. I know some people like to do it that way, but I'd just like to ask if there's any amendments or matters arising. No, so we're happy to approve the minutes? Okay, great, that's the minutes approved. So moving on to item 2. Sorry, I'm kind of thrown a wee bit because I've got James's crib sheet and I've also got the agenda. So it's actually item 3 in the agenda, which, no, sorry, it is item 2. Forgive me. Internal audit plan, and I'll pass to Andrea if there's anything you want to pick out of the report, Andrea.
Yeah, hi, Councillor. No, nothing in particular. The report is just an update on where we are with the audit plan, and it is for noting. I suppose the only thing I would say is that I have put out the remit and the engagement plan for risk management review, which is due to be starting soon, so I can get that in motion now that that's been sort of signed off, if you like, at an officer level. Happy to take any other questions.
Thanks very much, Andrea. Has anyone got any questions or comments for Andrea? No. Okay, so we're noting the progress against the internal audit plan for 22-23. And apologies, James, you've got this absolutely bang on, and it's me working with 2 bits of paper. Thank you. So moving on to item 3 now, which is a summary of internal audit activity in partner organisations, and it's back to you, Andrea.
Yes, this is a report that comes periodically to the board on the activity that internal auditors have done both within Renfrewshire Council and within the NHS. And it really just comes to this board for noting, so I'll happily take any questions, although I can't answer in any detail to the NHS side of the house, but happy to take any questions and I can take them away.
Thanks, Andrea. Any questions for Andrea in this report? Nope. Nope, you're getting off lightly. Okay, so we're noting the contents of that report. Happy to do that, yep. Okay, so moving on to item 4, which is the annual audit report on the IGB accounts 2021-22. And Sarah, do you want to say anything first, or we'll just pass straight to Pauline?
Happy to pass straight to Pauline, because essentially my report's just a cover, but she'll be able to talk through the actual report itself, if that's okay. Okay, so I'd like to welcome Pauline Gillen, and Mark Ferris is also here from Audit Scotland. Welcome, Pauline.
Thank you, Chair. Good morning, everyone. I'm actually not joined by Mark today. He has a Scotland Excel committee this morning, but I'm joined by Carla Graham, who's the senior auditor who led the day-to-day running of the audit. Thank you. So we perhaps just turn to page 25 of your pack, which is the covering letter for our papers today. So this letter here is addressed to this committee under ISA 260 as those charged with governance. The most important thing to note in this letter is at paragraph 1, where we state that the audit work on the 21-22 annual accounts is now substantially complete. And as a result, it means that I'm able to provide an unqualified audit opinion on the accounts. So that's the most important thing to note here. And after the accounts have been approved at the board next week, I'll be in a position to sign off a clean audit opinion. ISA 260 requires me to bring to your attention any significant findings that come from the audit, and we normally do that in detail in the annual audit report, which I'll come on to in a second, but I'm pleased to confirm that we actually don't have anything under that category to bring to your attention, which is a really good result for the audit. So I'll go on to that in a wee bit more detail when I get into the report. Also pleased to report that we don't have any unadjusted errors that exceed our reporting threshold of £250,000. That's another ISA requirement that I have to bring to your attention. Paragraph 7 outlines there some of the responsibilities of this committee as those charged with governance to bring to my attention any instances of actual, suspected or alleged fraud, any subsequent events after 31st of March, or any non-compliance with laws or regulations that haven't previously been brought to my attention. So I'll maybe perhaps just pause there for anyone to confirm that there's anything you want to bring to my attention. It's just a bit of a formality in the audit process.
Has anyone got anything? Oh, Max, do you want to?
Don't panic, it's not a fraud or something. Sarah, we're going, oh, what's she going to say? Don't worry. Hi, I'm Max Kerr. I asked this question at pre-agenda, and it's just because it's probably a sensible place to ask the question as well. In terms of subsequent events, there's no disclosure around the clawback of reserves for COVID monies. And my question was, is that a disclosable subsequent event? Because obviously you'll be aware of it, so it's not like I'm bringing that to your attention or anything, but I was just keen to hear directly from you as to why that's not in as a disclosure.
Yeah, no, thank you very much. It's a good point, and it's exactly the sort of thing that requirement is covering. So anything that's happened that you'd expect to see it reported.
Oh, I can't hear.
Yes,
I think we've. Oh, Pauline, we lost you there for a wee bit.
Later.
Oh, Pauline, sorry to interrupt. We lost you there for a wee bit.
Try again.
So
yes. So can you hear me now?
Yeah,
Can you hear me?
yeah, we can hear you
Pauline,
fine now. Yeah.
I think you'll need to start at the beginning of your answer because I think you went silent just as you started speaking. Sorry.
Okay. Typical. It was really good what I said. I'll try and replicate it. Yes, I was just confirming that disclosure in the letter is exactly the sort of thing that we're looking for in terms of what we would refer to as post-balance sheet events. And we did discuss with finance whether that would be something that we'd expect to see adjusted in the accounts. And for a number of reasons, we were content that it didn't represent a post-balance sheet event that required disclosure. For a number of reasons. One, the actual amount of the clawback is uncertain at this stage. I don't think it's been confirmed by Scottish Government, and also the mechanism for clawing back that money. It's not been confirmed how that's going to be clawed back. So because of those areas of uncertainty, we didn't consider it to be something that would need to be disclosed in the accounts. We do mention it in the annual audit report, but just purely on a factual basis, just stating the position as we currently know it. So that's the reason why we haven't required an additional note in the accounts.
Thank you. I thought it was just worth highlighting that. Thank you.
Thank you. Okay, so I'll perhaps move on. So in the covering letter, you'll see at Appendix A is our proposed independent auditor's report, which has already been inserted into the accounts and will be signed hopefully by me next week after the board meeting. Appendix B is a letter of representation under ISA 580, and this letter is a standard letter that members will have seen in previous years, and it's signed off by the Chief Finance Officer at the same time as the accounts are signed, and provides a number of management assurances to me as the appointed auditor. So moving on to the annual audit report, so that's at page 35 in your pack, the next paper. I'll take the report as read, so I won't go through it in a huge amount of detail. This report summarises the findings of our work on the audit, so the financial statements, but also the 4 wider dimension areas for 21-22. So the first page there, you'll see our key messages. So those are essentially the key judgments and findings from the audit work. Moving on to paragraph 27, page 44 of the report. As I confirmed earlier in the covering letter at paragraph 27, we confirmed that there are no significant findings as defined by ISA 260 that I need to bring to your attention today. Exhibit 2 underneath, you'll see there we report on the work that we carried out in relation to the significant risks of material misstatement that we identified as part of our planning, and which members will have seen in the annual audit plan that came to you earlier this year. So we identified one significant risk for the financial statements, which is management override of controls. This is a standard risk that you'll see in every set of annual audit plans, because it basically relates to the ability of management to change controls or to adjust figures in the accounts. The middle column has our audit procedures, so the work that we carried out during the audit to provide assurance over that risk. And in the final column there, you'll see the results and the conclusions from that work, and there were no issues identified from the work that we carried out. So underneath that, paragraphs 29 and 30, we identify a couple of misstatements in the accounts that we required to be adjusted in the accounts. Neither of those exceeded our materiality level, so we had no issues and didn't require to do any further audit work in response to those misstatements, and we were content with the adjustments that were made to the accounts. So if we move on to Exhibit 5, which is at page 49. So this outlines another risk that we identified as part of our planning and which also appeared in our annual audit plan, and that's in relation to our wider code responsibilities under the Code of Audit Practice, and it relates to financial sustainability and financial planning over the medium to long term. So you see there that we've highlighted the work that was done to project a budget that projected a budget gap of between 46 and 69 million period 25-26, and the need to deliver significant savings to be able to balance the budget. In the final column, you'll see there the results and the conclusions from that, and it'll come as no surprise to you to know that that's similar to what you'll see in all annual audit reports for integrated joint boards and indeed for all public sector bodies. It's a common theme with the current financial challenges that everybody's facing. So as a result of that, we, as you would expect, have that in as an action plan. So that's at Appendix 1, page 57. And you'll see there that we have a really comprehensive management response to that action plan point about what management are doing, and also a target date of March 2023 for management to pull together a list of identified savings for the board to approve next year. So perhaps pause there, and I'd just like to take the opportunity at this point, in case I don't get a chance again, to just thank Sarah and her team for all the support and assistance that they provided to Mark, Carla and the rest of the team to enable us to get to this stage of the audit. So just to extend my thanks. As I said, I'm joined by Carla today, who's the senior auditor for the audit, and we'd be happy to answer any questions that members have. Thank you.
Thanks very much, Pauline, and thanks to you. And you also signed off the council accounts yesterday, didn't you? So it's nice to see you 2 days in a row, and thanks again to Carla for coming along. Any questions or comments for Pauline or Carla? No. The only thing that I wanted to say was, as you said, Pauline, well done to Sarah and the team, and welcome to Shan Ramsey, who's new in Sarah's team, and welcome to the IJB and the audit board, Shan. It's good to hear that we got a positive report, Pauline. Really pleased to see that. And although some of the things that you say are quite stark about savings, etc., as you say, we were all too aware of that and expected that. But thanks so much. So if there's no comments or questions, we're noting the Audit Scotland report attached in Appendix 1, so we're happy to do that. Yep, great. Thanks very much. Okay, so we'll move on to item 5 in the agenda, which is the IJB Audited Annual Accounts 21-22, and I'll pass to you, Sarah.
Okay, thank you very much. Before I begin, just to remind the Audit Committee, this is the last time that it would be Audit Scotland that would be actually auditing us, and we changed to a different suite of auditors for next year. And again, I would like to thank the number of years that we've worked really closely together with Pauline and her team, and prior to that, the previous team. And it's been a really good working relationship, and we've worked very well, learning from them and us in both ways. But also, I would also like to reflect some quite sad news that we found out recently, that one of the team that used to work with Audit Scotland recently died, and Kenny McFall, and he was actually part of the original shadow year when we did the accounts, and was instrumental in helping us to produce the accounts to the high standard that they continue to be today. So I just wanted to mention that, because it's been a huge loss to the team, and I know that they'll all be suffering for that. And he was a very, very well liked man, very helpful, and he will be sorely missed. So On that note, I'll just continue with the process today, which is about, I won't go through the accounts, we've all been through them in June and also at the pre-agenda. So rather than go through page by page, today we're asked to consider the annual accounts for 21-22 and submit the audited annual accounts to the IJB for approval and signature. But I'm also happy to take any questions on the accounts themselves today.
Thank you, Sarah. Apologies, there's some commotion going on outside my door. I don't know what it is, but hopefully it's not picked up in the recording. Any questions or comments for Sarah? No. Mags?
Hi, it's really, I guess I always feel nervous about saying nothing because it sort of implies that it's not important. So I really just want to, for the record, say that the comments that I'd previously made back in June before the accounts became public and at pre-agenda, we always have a good discussion, and Sarah's always really responsive, whether it's Sarah or the team coming back and clarifying points, and those have all been reflected. So I feel that the accounts are in a really good position, and I don't have comments on them, but it's not because we've not had any opportunity throughout the period of review. So thanks, Sian, nice to meet you today, and thanks to Sarah and the team and the auditors. So because it's awful if you go, oh, there's all that effort and then nobody makes a comment or anything, but the reality is all my comments have been addressed in advance. So thank you.
Thanks for that, Mags. Yes, that saved me saying it, because I share that concern that silence seems like things have just been nodded through when we've actually spent a lot of time and a lot of discussion and lots of questions. So yeah, for the record, thanks for saying that. Okay, so as we've got no questions or comments further than that, we are considering and submitting the audited annual accounts to the IJB for approval and signature, which is next week. So lots of nods, we're happy to do that. So thank you. Okay, so we're moving on to item 6, which is an update on the risk register, and I'll pass to David.
Thanks, Chair. I'll just give a very brief overview of the contents of the paper, which sets out the continued work that we're doing to implement the risk framework, and also sets out the changes that we've made to the risk register. And the paper is seeking the committee's approval for the changes that are set out to the risk register in the paper. I think based on conversation we've had and noted through previous agenda items, one of the key elements that we've reflected in the risk register is the increasing financial pressures and challenges for the IJB and HSEP. And so we've increased both risks 1 and 2 within the risk register to reflect that, and in particular reflect the impact of the cost of living crisis, inflation, which is still very high and is projected to continue to remain high for some time, and also the budget pressures which we're seeing on the IJB and also on the wider health and social care sector. Related to those, we've also updated risk 3, which relates to physical and mental health inequalities, and that's really reflecting the impact of the cost of living crisis on physical and mental health. And we also note the work that the HSEP is doing in relation to the Council's Winter Connections programme to support local communities through the coming months. We've also, linked to those risks, increased the risk relating to the failure or loss of a major service provider. And again, that's related to the financial pressures being faced by providers in the sector, again relating to pay, energy and supply chain costs. And we are seeing additional we are having additional conversations with providers in the sector to reflect the challenges that they are facing at the moment. We continue to work closely with them. And then finally, I would just note that we've also added a risk relating to the potential for planned and unplanned power outages over the winter period and beyond, and the impact that those would have on our essential services. Whilst those potential scenarios are still deemed unlikely, it is important that we plan for them effectively in advance to make sure that, as far as possible, our services are still able to provide a robust and effective range of support to people within Renfrewshire. So we've captured that, and we also note the work that's ongoing within the HSEP to plan for that as far as we can do.
Thanks, David. Any questions for David on the risk register? No. Mags?
It's because the papers are good, it makes me think of questions. So Thanks, David. On the risk piece, I've said this before, I think the work has really come on in terms of articulating what the risks are, and none of these are surprises. So unfortunately, there's quite a long list of quite serious matters. Partly because it's a relatively new one that we've picked up on this, the risk about power outages. It made me think of business continuity more generally. I guess, are we saying that that's the aspect of our business continuity that's a new risk, and that we're actually, I guess our business continuity arrangements have been tested over the last few years, so it's just because this is a slight change and we're comfortable that business continuity is in a good place? So just to get my head around that.
Yes, well, business continuity, I think, is something that we've continued to work on over the last 2 years, and certainly in recent months. I think that particularly the unplanned energy outage scenario is a new one that's getting increasing focus from UK government, Scottish government level down. So we are doing a lot of work with our partners to look at that in much more detail. I think it's one of those scenarios that would have such kind of wide-ranging impacts that it's something that if we prepare for that as effectively we can do, it means that all of our other kind of potential scenarios, we would be able to respond well to them. So we're almost kind of looking at that as the option that we need to think about, which is the most challenging for us. But if we have all the plans in place, then we'll be well prepared for all other business continuity scenarios. But certainly it's really a rolling programme of reviewing our BCPs to make sure that they are up to date and that these sorts of new risks and issues that are emerging are captured within them. And if there's any kind of changes or additions that we need to make to them, that we make sure that they're built in.
Thanks for that, David. Does that answer your question, Mags? Yeah. Yeah. Okay, I don't think we've got any more questions in the risk register. Again, we had a good chat about that, and particularly around the cost of living crisis. So thanks for that, David. So we are noting the contents of the report and approving the updates. We're happy to do that. Yep. Okay, great. So moving on to item 7, which is the IGB Directions Annual Report, which Frances would normally cover, but Sarah, I believe you're going to cover for her as she's on annual leave.
Yes, I'm going to cover it.
Thank you.
I won't go through in vast detail because members will be aware that the directions come to the IGB and are usually at the back of each report, highlighting what directions, if any, are required to be taken forward to our partner bodies. So the detail of all of the directions that have been allocated this year are included in Appendix 1 of the report, and you'll see that there were 12 directions issued throughout the year, and some of which 6 still remain open. And the reason that those remain open is because they're ongoing and they're refreshed and are directly linked to the reports throughout the year. So that's why they remain open. So basically, members are asked to just note the contents of the report today, and happy to take any questions on the directions. As you'll see, the majority relate to the financial side of things and the budget monitoring reports.
Thanks, Sarah. Any questions for Sarah? No, it's a fairly straightforward report, as you see, so thank you for that. So we're noting the contents of the report. Thank you. Okay, so item 8 is inspection of Montrose care home by the Care Inspectorate, and I think we've got Phil McDonald this morning in place of Karen. Phil, are you here? Oh, you are here. I knew you were in another meeting, so I'm glad you've made it on time. Thanks for coming along.
Hi, good morning. Yeah, so my name's Phil McDonald. I'm Service Manager for Hospital Discharge Care Homes and Day Services. So I'll just kind of outline the reports that you've got. So 2 of the care homes, 2 of our 3 care homes were inspected in August 2022, initially Montrose Care Home and then Renfrew Care Home. Some of the key messages from the inspection of both care homes were that staff were treating everyone with kindness, compassion, dignity and respect. People had up-to-date assessments and care plans that informed their care and support. Service was clean, odourless and dust-free, and the management team acknowledged that the improvements to their infection prevention and control were necessary to be in line with the best practice guidance in the National Infection Prevention and Control Manuals. Looking at Montrose initially, for context, Montrose Care Home currently utilises 36 of its beds across 3 houses. building's got capacity for 60 residents, but 2 houses are currently not utilised. There have been some managerial changes at Montrose, with a new permanent manager being appointed in spring 2022. So on the 17th of August, the Care Inspectorate began a 3-day inspection of the service. Following this, there were 3 previous areas for improvement recorded as met. And the Care Inspectorate graded Montrose overall as 4, which is good. Focus was on how well do we support people's well-being and how good is our leadership. The breakdown of those grades were that, you know, under health and well-being benefiting people's care and support was graded at 5, which is very good. People's experience in meaningful contacts that meets their outcomes, needs and wishes was graded as a 5. Again, that's very good. And people's health and well-being benefits from safe infection prevention and control procedures and practice, which is graded 4 as good. And the final area was quality assurance and improvement is led well, which is graded 4. Again, that's good. The report noted that decisions about care and treatment were informed by care plans and a range of good practice tools, reviews and risk assessments. Noted that the service had developed close links with external healthcare providers who visited regularly, and staff were quick to notice any changes in people's needs and followed up with health professionals. Also recognised that relatives and friends like to be involved in a person's care and support, and inspectors saw evidence of relatives being able to assist in some tasks. Previous areas for improvement were all met, what concluded the report. I'll move on to Renfrew care home now. Again, for context, Renfrew currently utilises 48 of the beds across 4 houses. Building's got capacity for 60 residents, but 1 house isn't utilised currently. Renfrew care home's long-standing manager retired at the beginning of 2022. Therefore, a new permanent manager was appointed in late spring of this year. So on the 31st of August, the Care Inspectorate began an unannounced 3-day inspection. Following the inspection, there was 1 area of improvement recorded. 3 previous areas for improvement were recorded as met, and the Care Inspectorate graded Renfrew overall as 4, which is good. Again, focus was on how well do we support people's well-being and how good is our leadership. Breakdown of these grades were health and well-being benefits from care and support, which is graded 4. People's experience, meaningful contacts that meets their outcomes, needs and wishes was graded 5, which is very good. Health and well-being benefits from safe infection prevention control practice was graded 4, and that's good. And quality assurance and improvement is led well, graded 4, which is good. The report noted that staff were observing residents with dignity and respect. One inspector noted that a relative said staff have been amazing over the last couple of years. Mainly they've gone above and beyond any job grading, looking after the relatives in the home at the most difficult time of circumstances. Management team informed inspectors about new initiatives being implemented to further improve the multidisciplinary care and support that people are experiencing. And noted that decisions about care and treatment were informed by care plans and a range of good practice tools, reviews and risk assessments. Previous areas for improvement were all met. Like I said, there was 1 area for improvement identified. Inspectors found medication management could further be improved by implementing robust PRN as required, medication protocols for further support, the stress and distress care plans for people living in the service. Inspectors noted, and they were very pleased to see that during inspection the management team responded and started to work on improving medication procedures. The care home service does have a protocol in place for administration of PRN medication, supporting the care staff to manage stress and distress behaviours of residents appropriately. There's recognition that care staff in Renfrew would benefit from some practice development around using the protocol and recording decisions made with more clarity. So an example of this would be observing distressed behaviour and taking steps to de-escalate, and only if this wasn't achieving a positive outcome for the resident should PRN medication be administered. These steps should be clearly recorded, as well as the outcome following medication being administered, which would evidence, a positive effect being achieved. So that concludes Renfrew's report. It's anticipated that Hunter Hill Care Home will have an unannounced inspection within the coming months, as such, preparatory work is already underway to identify any areas for improvement and readiness for the anticipated inspection. Okay, happy to take any questions.
Thanks very much, Phil, and thanks for covering for Karen this morning. Any questions for Phil? Fiona?
No questions at all. I suppose it's really just a comment. I know that it's been incredibly difficult for staff in any of these care homes over the period of time. First of all, because they've been dealing with COVID, and I suppose in the complex set of arrangements that goes in there for staff, and the fact that actually we have a bit of a staffing crisis. So from my perspective, these care inspectors are out now, and the inspections are very robust. And meeting or having good and above is a bit of an achievement. I know that there are other services who are kind of struggling just now just to provide the evidence, because really all they've been doing is caring for people. So I suppose it's just a comment to say well done to the staff that have actually been working in care homes under what's incredibly stressful and difficult circumstances. So it's really just a comment in the report, Jacqueline, rather than any question. Thank you.
No, thanks for that, Fiona. It's really important to welcome that and thank the staff in the care homes. And you're absolutely right. At the pre-agenda, we were having a chat about the grades nationally and how those grades are actually, you know, way above what the average is across Scotland. So that's a good point to make. So thanks again for that, Phil. And we're just noting the contents of both the reports. So happy to do that. Yep. Oh, Max, you've got a question?
Yeah, and it's just, I guess, an extra well done as well, because one of the key challenges with my health board hat on is delayed discharges and how we're dealing with that interaction between acute service and care homes. And Renfrewshire is performing very well overall and has been for some time. So it's just an extra thank you that, you know, I'm not sitting in those meetings worrying about our performance here, because Renfrewshire has been performing very well in very difficult circumstances, and that's down to all the decision making that happens day to day. So just felt it was worth adding that in.
Thanks for that, Max. No, absolutely. I don't ever waste an opportunity to blow the Renfrewshire trumpet when I can on that. So thanks to Christine and the team for that. Okay, so we've noted the contents of those reports. So the last item is just the date of the next meeting, which is Friday the 24th of March 2023, believe it or not. And just to let you know as well that there's a report going to the IJB next week to recommend that both the IJB and this board remain online via Teams until June 2023, and then we can review it afterwards. I think we've got difficulties in terms of, you know, recording equipment and things like that, and just where we can go. Normally we're in the Abercorn, but we would need equipment for that. So we'll be reviewing that in June, and we can talk about that at the IJB next week. So thanks everyone for coming along this morning, and I'll see most of you next week. Bye for now.
Thanks, Jacqueline.
Thank you.
Thanks,
Bye.
everyone.
Thanks, bye.
Bye.